Hi, my name's John Kitchens, and I'm a retina specialist at Retina Associates of Kentucky and Eye Care Partners. And I would like to talk to you about your condition or your family member's condition. Let's talk a little bit about diabetic retinopathy and diabetic macular edema. Diabetes and high blood sugars over years and years can damage the blood vessels in the back of the eye. These blood vessels can become leaky, and if they leak fluid into the area of center vision called the macula and swelling results, you can have blurred or distorted vision. This is called diabetic macular edema and is the leading cause of vision loss in patients with diabetes. As time goes on and the damage progresses, those blood vessels can shut down and the peripheral blood vessels can fail to deliver blood to the retina. Your body tries to fix this by growing abnormal blood vessels. Unfortunately, those abnormal blood vessels don't grow properly to repair the retina. They grow up into the vitreous gel in the eye. They can be pulled on, can bleed, and can cause loss of vision. This is called proliferative diabetic retinopathy and is the leading cause of blindness in diabetic patients. Your doctor can monitor you with OCT scans, pictures, and an examination to ensure that you don't have diabetic macular edema and that you're not developing proliferative diabetic retinopathy. Importantly, however, if your doctor can detect this early and you can receive treatment for the diabetic macular edema and proliferative diabetic retinopathy, we can reduce the chances of significant vision loss. If you do have some vision loss from diabetic macular edema or bleeding in the eye from proliferative disease, we'll often do injections of anti-VEGF therapy to try and reverse these causes of vision loss. In addition, we can do laser to try and prevent these blood vessels from growing and bleeding. The laser might reduce the chances that you need to receive additional injections for hemorrhaging in the eye. Ultimately, if you have severe hemorrhaging in the eye or the scar tissue that forms from the blood vessel growth causes the retina to be detached, we might need to do surgery. If you have diabetes, it's very important to have a dilated eye examination with an eye care professional. If you have diabetic macular edema or proliferative diabetic retinopathy, it's absolutely essential that you maintain your follow-up appointments for your retina specialist to gauge how your eyes are responding to the injections or the laser and to determine if you need additional treatments. Once again, for most patients with diabetic retinopathy, we as retina specialists can make you better and can keep you from going blind, but we can't do it if you don't return for your follow-up appointments. What else can you do? The number one cause of progression of diabetic retinopathy from an early stage to a more advanced stage is uncontrolled blood sugars. Absolutely critical that you get your blood sugars under control. We strive to see a patient have an A1C of under 7.5, and under 7 actually can be even a bit better as far as reducing the risk of these vision-threatening complications. Once again, if you're a diabetic patient, having routine annual dilated eye examinations is critical. If you've been found to have diabetic macular edema or diabetic retinopathy, seeing a retina specialist, getting diagnosed, and following up per their recommendation is absolutely critical. Thank you again for watching and appreciate your attention.